Are you experiencing a headache, stiff shoulders, low back pain, numb fingers, excessive sweating, frequent urination, disturbances in the visual field, memory problems, insomnia, dreaminess, chest tightness, an irregular heartbeat, constipation, diarrhea, or tinnitus, and none of your doctors could put the puzzles together? Well, this could be symptoms of dysautonomia. Nowadays, more and more people of any age, gender, or occupation have been impacted by dysautonomia and disrupted sleep patterns. Most people with these symptoms choose to do many types of checkups in hospitals or specialist clinics, while many actually wait a year or a year and a half to learn they have dysautonomia. It is so difficult to diagnose that medical personnel don't make a conclusion easily. When a patient only shows early signs, they also need to take other possibilities into account. To avoid a delay in treatment, most patients may find it tough and helpless during such a long diagnostic process. Those who have early-stage symptoms will normally get medications that help them fall asleep. Dysautonomia can be caused by many reasons, like an irregular lifestyle, excessive drinking, drug addiction, or in most cases, psychological factors such as childhood trauma, an extreme personality, introversion, pessimism, irritability. It can also be psychosomatic. For example, school pressure, academic, work, and life pressure. The impact after losing your loved ones, poor interpersonal relationships are all related to it. It doesn't happen overnight. From the perspectives of spiritual science, it's the decrease of one's light body energy. Some dysautonomia patients have no clue how they get it and don't know what to do. Some of them decide to try everything they think of to figure it out by themselves. If you are certain it's dysautonomia, get yourself prepared. From that day onwards, no matter what stage of the symptoms you are at, you have to make major adjustments to the way you live your life, mood management, or even your work pattern. And it is extremely necessary. It won't just go away until you start to take it seriously. Dysautonomia is a mental illness that affects you physiologically. Medication and counseling are the most common treatment. Some people choose nature therapy, decide to work out more, and adjust their habits, which is good and actually helps. Yet, most people don't know the fact that dysautonomia brings physiological and psychological changes to you. The autonomic nervous system is a vital control system that maintains physiological mechanisms and regulates bodily functions. The breathing, heart rate, body temperature, sweat secretion, digestion, gastrointestinal motility, and so on, all relied on the autonomic nervous system. It acts largely unconsciously and regulates body processes automatically according to changes in the internal and external environment. Once a disorder happens, one's physiological and psychological conditions will become chaotic. To put it differently, if the light current inside the body gets weaker, causing voltage instability, the automatic controller becomes abnormal. People react to dysautonomia differently. For example, someone may have an abnormal heart rhythm. All of a sudden, it feels like the heart is about to stop beating, and then it beats too fast in a second, making the patient start to be panic and think it's a heart attack. They stop breathing and begin to breathe heavily again, as if they will breathe their last anytime. They feel extremely weak and sensitive to the cold. Even sleeping under many blankets cannot stop the chills, like sleeping in an ice house. They sweat so much because of these blankets that the bedding becomes soaking wet. Some people may experience a headache, vertigo, or tinnitus that rings in various intolerable frequencies in the ears. Stomach ache, too much gastric acid, and abnormal gastric motility are also the symptoms that are often mistaken for gastric hemorrhage. Irregular bowel movement occurs too. These people have diarrhea whenever they eat and become really weak, which is often mistakenly believed to be stomach flu. As common as the symptoms may sound, they are something people won't truly understand until they happen to them. The symptoms differ from person to person. We have to think about the nature of what makes our physiological and psychological mechanisms chaotic. After you go through this stage, you move to the next phase of it. What I'm trying to say is when our body is no longer functioning well, we have to consider what we have lost and how to fix it. Here are the three aspects we can work on: our light, mental, and astral bodies, which are three of our energy bodies. To start with, we try to put ourselves together for our family and those who care about us from now on. Walk in nature and travel around. Try some light workouts. Avoid strenuous activities. Do something meaningful. Get rid of negative habits. Do not abandon yourselves to despair, because we still have a long way to go. Next, have a regular lifestyle and adequate sleep. If you find it difficult to fall asleep, try to relax yourself physically, mentally, and spiritually. To be specific, relaxing your body is to shut your physical sensations and feelings down, and to breathe slowly, as if it's effortless and deep. This is the only way to get your autonomic nervous system back on track to calm your mind. Just stop thinking. Stop looking back. Stop worrying about the future. All the upset and agonies come from our own minds. Calm it down. An optimistic philosophy of life is the key to maintain our mental body and light field. To soothe your soul, reprogram your subconscious, and get to know the meaning of life. Only a good perception of life makes sure our physical, mental, and astral bodies merge and resonate. In the Christian belief, it is called Trinity. When the body, mind, and soul, or in other words, our physical, mental, and astral bodies are three in one, there will be a resonance field. Gradually, the nervous system gets to be repaired, and the good health will be with you. I'm Dr. PH. This is science, not religion. Time is ticking. Please like the video and share it to your family members and friends, and ask them to help spread the ideas. You can help more people. Don't forget to subscribe and hit that bell icon. I'll see you next time. Bye-bye.